question answer session and maybe case. I'll discuss few cases. But before that, let us start with question answer sessions. So we are live both on Instagram and YouTube. Yeah, welcome Dr. Palak on Instagram. So let us start with some question answer sessions, and I'll immediately start if there are no questions now. Dr. Vishal, good afternoon. If there are no questions on live session, I'll start on my WhatsApp. I have few questions. Now, see, there are a lot of. There's a question on Instagram. Just a minute. Child boy bedwetting daily when missing day gets it out the chest. No dreams of urination. Urination has strong offensive odor. No sediments. No abnormal detected. Boy is lazy. Yeah, so of course, a very short case, but you can think about few remedies that are very important. Think about benzoic acid, think about soranum, think about creosotum, think about equisetum. Yeah. Next, there was a case, Dr. Meera, welcome. So there was a case where a very beautiful case I'll discuss today. Good afternoon, Dr. Meera. It was a case of fever, and the patient had fever since the past 8 to 10 days, and with fever there was a lot of cough, and there was a lot of pain in the eyes. There was the pain in the whole body, and we prescribed some medicine, but it did not work. On asking, the patient told that whenever he's sitting, whenever he used to sit and he used to just walk, he used to walk with slight bending, and then gradually he used to straighten up. While walking, there was so much weakness and there was so much pain in the body. And whenever he used to sit, the hands used to become stiff with pain, and he used to open the arm or the fingers with a difficulty. Few medicines prescribed did not work, and then I prescribed a very simple remedy, Ubiquinone perf 1 ml single dose. Next day morning, all symptoms absolutely fine. The pain went, the fever went, which was for the past 8 to 10 days. The cough went, the pain in the eyes went. Everything was fine with just 1 dose of Ubiquinone perfolatum. The important thing to know in this case was that the patient also told me that he had so much pain in the eyes was so heavy that he could not lift up the eyes. There was so much pain in the eyes that he feels that the eyes will come out of the socket. There was terrible headache. The headache was very severe, and the patient could not work because of the headache. The fever was coming and going, not high, not so low, but he used to take paracetamol in between. And the extreme weakness. In this case, what happens then, we fail to understand which remedy to prescribe at that time. Whether gelsemium, whether belladonna, whether hiparsal, because he had pain in the throat also. But as I always say, the most important syphilitic feature of that remedy, of that patient, the most important syphilitic feature that is very, very three marking, that is very, very seen easily by the doctor and understood by the patient. In this case, I took the important symptom to differentiate remedy was the pain. The pain in the whole body was the most important striking feature of this patient. The pain was so severe, the patient could not walk without straightening the back for some time. There was a lot of stiffness in the bones. He had difficulty in opening the fingers, and with that symptom, Ubiquinone perfolatum was prescribed. So this is how you have to differentiate your remedies with symptoms, so that you are not confused which remedy and what remedy to use, either belladonna because it has the same headache, it has the same pain in the eyes, it has fever, or gelsemium which has the same symptoms of heaviness, but it does not cover the totality. So in this case, Ubiquinone perfolatum gave me a very good result. Single dose Ubiquinone per 1 ml. Next day the patient was absolutely fine. So this is how your prescription should be also in acute case. Whatever I have seen in my practice, I always say most important defining feature of the patient that you take for prescription, and then it will give you very good results. Okay. So hello, Dr. Babel, welcome. So this is how you basically have to understand your case. In fact, there was if I have any questions on WhatsApp or Instagram, I'll answer that. I'll give you some more symptoms related to fever. I had a very interesting case, that the patient came to me that he was suffering from fever. I hope we have no questions before I can start. Yeah. So there was a very interesting case of fever, and the patient said that I keep getting this type of fevers since years and years now. Every week, every 15 days, I get fever. I take medicine. I'm better for some time. Then again, I get fever. I'm better for some time. It keeps on coming. So whenever you have symptoms where Dr. G S, welcome. So whenever you have these type of symptoms, be very sure that you are basically looking at fevers which are very relapsing. That means the patient, the immunity is not able to fight that fever from the system, and that's why it keeps relapsing. And in case of relapsing fevers, there are few remedies which are very, very important. The most important remedy I've seen in case of relapsing fever is soranum, sulfur, and calcarea carb. In fact, if you have never given soranum or even thought of fevers which are relapsing, that means you have missed that remedy and you have not able to cure that patient totally, because soranum will give you very, very good results in cases where the fevers are relapsing. Of course, it is the few symptoms of soranum that are very important, that you have to understand that the body odor is filthy, there is great sensitiveness to cold, elements from suppressed itch. And most of them, in cases of relapsing fever, you will find that a lot of patients will come and tell you that he was suffering from slight skin disorders, slight pus, slight pustules, acnes, and he had taken treatment for that. After that, there is no skin symptoms. But now I get recurrent fevers. In this case, don't always think of sulfur, but do think about soranum also. In soranum, it is written that elements from suppressed itch or other skin diseases. Elements from suppressed skin or other skin diseases, especially if you see in Allen's keynote, it is written when sulfur fails to relieve. When sulfur fails to relieve, then you must think of soranum. Such an important remedy, soranum. In this context also, I had a very interesting case of relapsing fevers, and in that case, I gave the remedy soranum, which gave fantastic result, and the patient is in follow-up for me for the past 4 months, and there is no history of fever, no attack of fevers in the past 4 months, just one dose of soranum 1M. So this is how you must be able to treat your cases of fever, because in fevers, basically the patient, if you are able to cure fever in very fast in patients, you'll get a lot of confidence from your patient. Welcome, Dr. Arora. Mubin Sheikh. I have one question. Then I'll I have question both basically on Insta and YouTube. So I'll first ask the Insta question. Sir, bedwetting, creosote, benzoic acid, yeah. Equisetum, no dreams of urination, no parents could. Yeah, that's why I'm telling you. You can try this remedy which I have told you, because this remedy have given good results. You can add 2 or 3 remedies that comes to my mind. First, what I told you, you can add calcarea carb, you can add medorinum, and you can act one more remedy that will also give you good results, and that is natrum ars, which I have got good results with. So one question from Dr. Sheikh is gastric ulcer, homeopathy medicine so cure ho sakta hai kya? Yeah. There is no problem with gastric ulcer. If you have got the endoscopy report, just see the report with gastric ulcer, where it is, and then start asking the symptom, because sometimes what happens, we prescribe on normal symptoms of gastric ulcer, and that's why we are not able to cure the complaints. So in case of gastric ulcer, do take the case and do take symptoms of stomach or gastric ulcer, which basically are different from the medicine part. For example, if the patient says, whenever I eat, I start getting burning, and you have gastric ulcer on the first part, second part, first rule out the common symptoms of the disease and then take the case and then take that symptom for prescription. So it would be easy for you to prescribe and get the remedy. And of course, gastric ulcer is definitely curable. There's no problem about it. Good evening, Dr. Singh, Dr. Vishaka, good afternoon. So I was telling you something about fevers of lately. Basically, there is a lot of viral fevers. We are getting it. So I was just taking one of the class of fevers for my assistant doctor. So one fever, I told you about relapsing fever. I told you a case of Vibutyrum fever. One fever that basically I would like to tell you. Some patients will come and tell you, Doctor Saab, I have fever, but it does not come out of the body. मेरे बॉडी गर्म लगती है बट इट डज नॉट कम आउट ऑफ द बॉडी. इट इज लो फीवर्स, लो फॉर्म्स ऑफ फीवर्स where the constitution is not so maybe active that it can get the whole heat of the body, or the constitution is strong that it's able to suppress the fevers or not let the fever out of the body. Both is possible. In cases of fevers which are low form, there are 2 or 3 remedies which are very very important. The patient comes and tells you, I am not well, doctor. I have fever, slight weakness. I have, but on thermometer the fever does not come. If it comes, also it's only 1 degree or 0.5 degree here and there, and it goes off. It becomes better automatically. But I feel not healthy. I feel weak. The appetite is poor. I cannot work totally. If the patient complains about these symptoms, you must think about 2 3 remedies which are very very important. First, think about phosphoric acid. Think about rust ox, and think about arsenic. Lately I had a fever where the patient gave me a very beautiful symptom, and this symptom led me to prescribe this remedy. I'll just tell you this symptom. The patient said that when I was sitting, I had fever, and I thought, okay, fever, the body will fight the fever. But just as I got up and I started walking, the weakness was so severe that I thought, my God, I have so much fever and weakness, but when I was doing my work, there was not so much symptom. This was the only symptom. The patient came and I prescribed the remedy. Which is the remedy that comes to your mind on these symptoms? Anybody? Yeah, good afternoon, Dr. Kuchar, Dr. Vaishnav. Such a beautiful symptom. The patient was sitting in the office working. He said that I was feeling a bit feverish, low fever I had, but not so much. But as I got up from the chair and started to go home, I found so much weak, and I did not expect that I had so much weakness and so much fever when I was working. So this is a very very important symptom now. Any remedy? So Dr. Singh says rust ox. Any remedy that comes to your mind? Walaikum assalam, Dr. Hussain, Dr. Sharon. Yeah. So any other remedy? Chini Mars. Okay. Arsenic. Okay. If you open up, see, sometimes a patient will not come and only tell you symptoms of fever. I have a lot of fever, I have a lot of body ache, I have a lot of lethargy, I have a lot of appetite, and you're confused what to give because these symptoms are the normal symptoms of fever. If you open Allen's keynote, such a beautiful line, normally it is missed by everybody. It is written in Allen's keynote, exhaustion is not felt by the patient when lying still, but when he moves, he's surprised to find himself so weak. That is such a very important symptom of arsenic weakness. Don't ask the patient in fever that are you feeling weak, or the patient only will come and tell you that I have fever, I have weakness, I have malaise, general, and we think about remedies. But remember the weakness of arsenic. It is written, exhaustion is not felt by the patient when lying still, but when he moves, he is surprised to find himself so weak. And exactly that same line was basically narrated by the patient when he was in the office. See how homeopathy symptomatically works beautifully, It is just how to convert that patient's language into the symptom form or the rubric form, and you get the remedy. Sometimes the patient speaks the word to word which is written in our Mater Medica, simple Allen's keynote. But if we have read that, it becomes very easy for us to prescribe. Of course, ferrum phos is a remedy basically prescribed for all type of inflammatory fevers, but this is not ferrum phos. This was, Meera, we are talking about arsenic album. So this is how, see, homeopathy is so easy unless you have to start, reading it. If you start reading homeopathy, automatically every symptom will come to your mind, and whatever the patient speaks, you can see actually in the patient, and the remedy will cure. So the remedy was arsenic album. So this is how you have to understand. Of course, I told you arsenic album, low fevers, rust ox, and phosphoric acid. Of course, there are some differentiation between these type of remedies, but for example, if you have seen in phosphoric acid in low fevers, I have seen in basically phosphoric acid. It is again written beautifully in the Mater Medica. The patient is absolutely listless, apathetic, and indifferent to the affairs of life. That is the first symptom you'll get in phosphoric acid. And as the fever goes worse and the patient goes in delirium, a phosphoric acid patient has delirium, muttering, unintelligent. The patient lies in stupor or in a stupid sleep. That's the delirium of phosphoric acid. I'll come back to that. First, I'll answer one question. Walaikum assalam. Can you suggest some group of medicines for chronic throat hawking or internal throat itching, which is aggravated by night and morning? Yeah. So, Dr. Sabnil, a very, very relevant question for today, because see, there are so many cases which comes to us. There are with throat complaints. The patient comes, Doctor Sahab, since 2 or 3 days there is irritation in the throat, and I feel better by taking cold. Sorry, by taking warm. I drink a hot tea, I drink hot water, and I feel better. These basically are a very, very common symptom which, welcome Dr. Bharati on Instagram. So these are very, very common symptoms basically which are present in today's viral fevers. First remedy that you should think about whenever the patient comes and tells you that there is irritation in the throat, I find difficulty in swallowing, I feel better by taking hot water or tea. First remedy that you should think about is, of course, everybody knows that, and that is Hepar sulf. Hepar sulf is a remedy which is very commonly prescribed and it definitely works. Suppose your patient comes and tells you that there is irritation of the throat, but when I sip normal water, मतलब मटके का पानी भी मैं सिप करता हूँ जो एक्चुअली ठंडा रहता है, I feel better. Immediately, you cannot think about Hepar sulf because Hepar sulf is better by warm. Immediately you have to change your track of thinking and think of other two remedies. Those are causticum and cuprum metallicum. Because in this, if the patient comes and tells you that he is better by sipping cold water, automatically the whole concept of treatment changes and the remedy changes. You must think about remedies like causticum and cuprum metallicum. Then we have cases where the patient comes and tells us that, sir, I have throat problem, but whenever I am deglutating, मतलब मैं जब भी थूक अंदर लेता हूँ, I get lot of pain in the throat and pain in the ears. And now if the patient is telling you these type of symptom, our again approach should change, because these are symptoms of then the remedy should change. Then you should think about Moxol, or you can think about Phytoleka, or depending on the side involved, left or right. Left side we have Merck Idoflavus, right rubrum. Right side we have Merck Idoflavus. So this is how you have to keep on asking symptom and then be able to prescribe. Otherwise, what will happen? You'll be landing up in one remedy, Hepar sulf. Or if the patient comes and tells you, I feel there is sharp pain as if something is there, like fishbone or splinter type, then you must think about nitric acid. And it goes on and on. There are some remedies which are group of remedies so common. And of course, then if this part goes, then you can think about lachesis, you can think about carbolic acid, you can think about baptisia. Symptom changes. So whenever you are prescribing on irritation of throat, especially in viral fevers, make sure that you define that throat symptoms in relation to throat, tonsils, ear, and deglutition, eating, drinking, hot, cold. Automatically you differentiate and then you get to the remedy. This what I have narrated is basically all common remedies which are used in a day-to-day practice. There are some rare remedies also which are prescribed, like we have Vithya, which is a classical remedy for chronic sore throat, Vithya and all. For chronic hoarseness, we have lachesis, we have Kali iode, we have Naxomica, we have Bovista. But most of the cases which I told you, the bunch of remedies like Hepar sulf, like causticum, like nitric acid, like mercury, Merck Idorubra, Merck Idoflavus, Phytoleka, very commonly prescribed, belladonna, very commonly prescribed, Hepar sulf. So these are group of very common remedies, and then if you have some very particular symptoms of other remedies, then you can think of other remedies. But these are the basic chunk and the bulk of remedies that you should think about in treating viral infection in today's day-to-day practice. I hope you got some symptoms, Dr. Sapnil, about the clinical manifestations of symptoms. Okay? I hope you got it, or I can give you some further insight. Or, for example, the patient comes and tells you that I have a lot of itching in the throat. Then also the remedy should change. Like we have Spongia, we have Vithya, we have Glonine, we have Apis mellifica. So depending on the symptoms, make sure first, whatever symptoms you're taking, They are basically very defining symptom of the pathology of the disease or the patient, so that it is a easily entry point to the case. I hope Dr. Sapnil, you got it? Yes, so we move forward. Yeah, so one question on Instagram. Yeah, some patients will come and tell you that the patient feels as if something has been lodged in the throat or something is there in the throat. Like for instance, we have symptom that something a pluck sensation in the throat, and is very disturbed by that pluck sensation. So when you have these type of symptoms, then pluck sensation in throat, of course, the first remedy that should come to our mind or that comes to most of the doctors is ignitia. If you go and see ignitia, there are a lot of symptoms of ignitia, where this pluck sensation in throat, difficulty deglutition, it is there. But I have found few remedies which are very, very useful in my practice. I have seen pluck sensory in throat with feverish feeling, with lot of irritation, with lot of anger. Then you must think about remedies like lachesis, natramur, sorinum, and other remedies like kali carb or kali bichrome. They are also very important in these type of cases. Of course, not to forget again hepar sulf. And if you have seen, hepar sulf will come in your prescription in most of the time when you're treating sore complaint, because if you open the mater medica of hepar sulf, it contains absolutely most of the symptoms that a normal common allergy or common response to throat is present. That's why what happens that in most of the cases we start a treatment with hepar sulf, and then when we fail we think about other remedies. But there are very minor differentiation in hepar sulf, which I think I've told you before also. Make sure you differentiate that and then get right to get the remedy. It is not that I also on the first instant prescribe the right remedy. I also sometimes fail. I also sometimes prescribe some hepar sulf too many times and fail, and then maybe look at the other symptom. Then on the second instant or on the third instant, sometimes I get the remedy right. For example, in hepar sulf, what I have seen in my practice, when swallowing, there is sensation as a plug or a splinter in the throat while swallowing. That is a very, very important symptom of hepar sulf which I have seen. Second symptom of hepar sulf that you must think in this practice should be, there is stitches in the throat which extends to the ear when swallowing. These two symptoms I have found very useful in differentiating hepar sulf from lot of remedies, because if you open mater medica better by drinking hot water or tea and irritation in the throat with general fever, you tend to prescribe hepar sulf. But just get the hairline differences of the remedy. What I did, this is stitches in the throat extending to the ear when swallowing, hepar sulf, and hawking up of mucus. That is also hepar sulf. Then you have symptoms of hepar sulf like tendency to suppuration and quinsy and all. But I'm just telling you how to differentiate these remedies. Yes, Dr. Vishal says yes. In cough series, it's a at best. Yeah. So this, in fact, if you have heard my cough series in my YouTube, I have tried to differentiate, a lot of cough remedies. In that also I have given something about hepar sulf. But lot of patients, lot of doctors, first instance we prescribe hepar sulf. That's why it's important to differentiate. For example, phosphorus with throat elements. Okay. So whenever you are prescribing phosphorus, no, it's again a very interesting question. And if you have seen phosphorus also, if you have seen phosphorus, that also covers most of the symptom in relation to throat complaints. But again, if you have seen phosphorus very closely, a phosphorus patient, there are some symptoms which are very, 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 very peculiar to phosphorus. Don't always think about phosphorus whenever the patient or wait for to prescribe phosphorus when the patient starts telling the mucus is rusty or there is blood in the sputum. Don't wait for that. If you wait for that, then it will always be late. So there are few symptoms I'll tell you some symptoms which are very common in throat complaints where I've used phosphorus and I've got very, very good results. First of all, of course, if you open phosphorus throat complaints and you start from the mouth first. It is said that in phosphorus, thirst for cold water, Phosphorus has thirst for cold water, which is very similar to causticum or similar to cuprum metallicum, first symptom. Of course, in phosphorus, there is also pain in the throat. And whenever there is a phosphorus, there is pain in the throat, the larynx are very painful. And there is tightness across the chest. The patient feels great weight on the chest. That is a very, very important symptom of phosphorus. Remember one thing, symptom of phosphorus, the cough is from the tickling in the throat. The patient says, especially in Hindi we say, Dr. Babal, gudgudi ho rahi hai, as if there is tickling in the throat. And the patient is worse in cold air. The patient is worse in reading, laughing, talking. And the patient comes in your clinic and says, when I come in your chamber, Dr. Sahab, I start getting cough. That is coming from warm room into cold air. That is the modality of phosphorus. The patient says, whenever I go in my AC room, I start getting cough. That is phosphorus. And the phosphorus patient has so much pain in the larynx that the patient cannot talk because of the pain in the larynx. So these 4 or 5 symptoms are very, very important differentiating feature, Dr. Babel, which I have seen in my practice. Of course, then you have symptoms of pneumonia and that the sputum is rusty, blood, purulent. But in acute viral symptom, whatever symptoms I have seen in my day-to-day practice, these are very, very interesting and differentiating feature of phosphorus which I have seen in my practice. I hope you got some input, Dr. Babel, about phosphorus. We have Dr. 75, I don't know his name, he's joined, welcome. I hope, Dr. Babel, you got something about phosphorus. Again, then there are other symptoms of phosphorus. Those are theoretically I have seen, but I have not seen clinically in my practice, that sweetish taste while coughing. It is there, beautiful written mathematic, but I have not seen that type of coughing in phosphorus sweetish taste. That's why I only told those symptoms which clinically I have seen. Larynx painful, the pain is too much in the cough, it hurts, the patient cannot talk because of that. Tightness across the chest, the patient feels the weight on the chest. Those are very, very important symptoms of phosphorus which I have seen clinically in my practice. Okay, Dr. Babel, I hope you got some input about phosphorus, because there were a lot of questions on WhatsApp and on the remedies. That's why basically I was telling something about throat symptoms. Yeah, that patient had better with hot drinks and okay, swelling heart things. Yeah, you can have that. I was just telling you the ABCD of phosphorus, what we see in viral symptom. But of course, these symptoms are there. Patient had better with hot drinks and hot drinks. You can have yellow urine is again a very important symptom of phosphorus, which I did not cover because I was just telling you something about throat. Better by swallowing something hard, worse from liquid. Yeah, you can have these symptoms of phosphorus also. I should say stage 2 symptoms of phosphorus throat. What I described basically is the differentiating feature in only throat complaints and acute complaints in relation to hepatic sulf or causticum or nitric acid and phosphorus. In that matter, see, whatever symptom you see, there will be all polycrest remedy basically would have all the symptom mostly related to throat and all. But okay, so we have one thing. Recently, I prescribed phosphorus tonate for post-COVID symptom, fresh red blood in sputum since last one and got result with 1 week. Now patient is on nitram phos. Very good, very nice, Dr. Sapnil, and very well remedy because that blood part of phosphorus was there. And post-COVID, basically, these symptoms are very common. In fact, if you are prescribed natrum phos, it's a fantastic prescription because after phosphorus, natrum phos is again a very, very important remedy and very good differentiation if you have done it. Very nice. So I was just differentiating some throat symptoms in that context. You must also remember one remedy which is very, very useful in throat complaints. Again, very common remedy, but you should able to differentiate. And that remedy, yeah, just wait. Dr. Vishal has a question. With your COVID nosode patient got relieved in 1 week who was not better even with best totality. Thank you. So we have a beautiful message by Dr. Vishal on the Instagram. And whatever COVID nosode I had sent to most of the doctors, and Dr. Vishal writes that when he prescribed COVID nosode, the patient got relief in 1 week's time. Even the best totality could not cure the complaints, but COVID-19 cured it. That means whatever medicines I have made with COVID is absolutely working very fine. And I have got a lot of inputs, from a lot of doctors, and also very nice and very good prescription, Dr. Vishal. I hope uh, people keep writing so that it also gives me something to cheer about, and it really helps me to understand the patient's perspective on how we are approaching our YouTube live, and it's basically clinical. So basically, I'm very happy that clinically you are getting good results with the nosode, and best of luck to your practice. One remedy that I had to differentiate today was basically pulsatilla. Okay, I have one question. What medicine to prescribe for increased RA factor without any symptoms like pain and swelling? No, see, rheumatoid arthritis, Dr. Anjali, is an autoimmune disorder. And whenever you're prescribing for autoimmune disorder, it's very important to understand the case. Something in the patient is killing himself. That one symptom, that one thought, if you can get from the patient, you'll be able to cure it. Because if you ask me just prescribe for autoimmune disorders, arthritis, I'll just give you some remedies for pain, simple remedies like Rustox, like Formica rufa, like Vicum, like Nigodium, Ornophyllum, Arnica. But I'll not be happy, because symptomatically the patient would be better for some time and again back to square one, and will be suppressing those complaints. The patient will be in suppression, and one maybe after few months or years he'll suffer from arthritis deformis, where the deformity has happened and now you can't do anything. So just take one case, just one syphilitic symptom, that one thought which is killing the patient, that is the entry point of the case. So I'll just complete pulsatilla, because we had put 3 to 3:30 only question answer session. In pulsatilla, one thing is very important, dry cough in the evening and at night. The patient has to sit up in the bed to get relief. Please write these symptoms in a Mater Medica. A pulsatilla cough, dry cough in the evening and at night. Suki khasi, he has to sit up in the bed to get relief. But loose cough in the morning with copious expectoration, and that's a classical symptom of pulsatilla. Clinically, the patient, if you ask the patient, how is your cough? It is dry or wet, and the patient immediately tells you, I have both the type of cough. In the morning, my cough is very loose and lot of mucus comes out. But in the evening and at night, my cough is very dry, so I have to sit up in the bed and get relief. That is the wording of a pulsatilla patient. Remember that. And then you have symptom like causticum, that the urine is emitted with cough. And the expectoration in pulsatilla, it is blend, it is thick, it is bitter and greenish. These are the only 2-3 symptoms which I have found. And one thing I have seen, bitter taste in the mouth. These 2-3 symptoms, if you understand, then you will never miss a case of pulsatilla in this viral condition, because lot of cases you will find that we prescribe only on the patient is coughing, dry cough in the night, and we only take that symptom for prescription and forget that loose in the morning. And that's how we make a mistake. So make sure that if you want to prescribe pulsatilla, these 3-4 symptoms are very, very important. Okay. So do we have some more questions today? Yes. So I have a webinar at about 4 o'clock. So I just wanted only half an hour today for the YouTube session, but still I can answer a few questions, 1 or 2 questions if you have. Anybody? But I hope I'm able to differentiate the remedies: Hiparasulf, phosphorus, pulsatilla, arsenic, Eupotium perfolatum. Very, very important remedies in these conditions, today's conditions where there's a lot of viral symptoms, So make sure that you are able to differentiate and then prescribe the remedy. Okay. Naxomic and equine and coryza, but both have what is sneezing, aggravation, and cold dry. Yeah. So Naxomica. So whenever you are prescribing Naxomica, so first of all, if you have asked me a question to prescribe Naxomic, it is very wonderful, because normally, we don't prescribe Naxomica for cough and all, but if you have thought of it, it is very nice that there are some symptoms which are very, very important for, of course, aconite, everything is sudden, violent, westerly wind and all, and aconite is, but if you want to prescribe Naxomica, there are some symptoms in Naxomica which are very, very close and very, very important to understand. If you have, I think if you have heard my YouTube channel, I have told something about Naxomica cough. If you have not, please go and again see that. But as you have asked me, I'll just tell you few symptoms of Naxomica which I use in my practice. I don't know how people use it, but clinically. In Naxomica, remember Dr. Singh, cough brings on headache. द पेशेंट सेज मेरे को इतनी खांसी आती है, ऐसे लगता है मेरा सिर फट जाएगा एंड आई हैव टू होल्ड द हेड ताकि मेरा सिर फटे ना. दैट इज द कफ सिम्टम्स ऑफ नक्सोमिका. कफ विल ब्रिंग ऑन अ बर्स्टिंग हेडेक or the cough will be bruised pain in the epigastrium, and that is Naxomica. I hope you understand this symptom. Cough, bursting headache and epigastric pain, first symptom, and dry cough. Dry cough, and sometimes the expectoration is blood. It tastes blood, very close to phosphorus. And the patient comes and tells you that the cough, there is sensation as if something is torn loose, ऐसे खुल गया छाती में, इतना कफ रहता है. And that is the cough symptoms of Naxomica. Only these 2 or 3 symptoms which I have seen in my practice. First, cough with bursting headache, cough with pain in the epigastrium, dry cough, sometimes blood comes out in expectoration, and sensation as if something was torn loose in the chest. This is the only symptoms I have seen in my practice. I have used Naxomica sporadically when these symptoms are present. And of course, aconite napellus, we don't need to see aconite nap. Everything is sudden and violent. And it is caused by exposure to dry, cold air. It is said that dry northwest wind and all. But there's great fear, there's great anxiety of mind. That is aconite napellus. Good afternoon, doctor. And one more question, Dr. Gallstone therapeutics. Gallstone therapeutics, I have basically told in my previous webinars also. Coryza. Basically, I have not used Naxomica in Coryza, but in aconite, I have used Coryza where there is a lot of discharge from the nose. There's watery discharge. There is a lot of sneezing. In those cases, I have used aconite with very good results. If the patient comes immediately. Differentiating with Justicia, Justicia has a lot of sneezing and aconite has lots of water discharge. Naxomica I have not used in Coryza, so I can't answer that question. Of course, mathematic wise, I know that remedy, but I have not given in that case. So just coming back to Dr. Vishal gallstones, I have told in my previous YouTube live, but there are some remedies which are very, very important for gallstones. You must think about Filtowry, Cardusmar, Berberis, Colocynth, Belladonna. These are very, very common remedies for gallstones. Okay. So I think today we had only half an hour. Rest, next questions put on my WhatsApp or I'll complete in the next YouTube live. So thank you for joining and thank you for time.